Okay, we have a survey of naturopathic physicians, implications and recommendations by Joseph E. Pizzorno Jr., published in Alternative Therapies in Health and Medicine, July-August 2002. Naturopathic practitioners have for a century considered themselves physicians of natural medicine. With such unique positioning comes public expectations of practice sophistication, evidence of efficacy, and accountability. Pizzorno considers whether CAM doctors are living up to those expectations. Randomized controlled trials are unquestionably the gold standard for evaluating single interventions for the treatment of specific diseases. However, this methodology is difficult to apply to complementary and alternative medicine practices, especially the comprehensive, multi-therapy, and individualized interventions characteristic of naturopathic medicine. Further complicating this research is the naturopathic physician's clinical goal of health promotion, as well as disease treatment, which requires assessment of clinical outcomes other than disease parameter improvement. The naturopathic profession is more than 100 years old, and many of its specific interventions have been studied. However, systemic reviews of its comprehensive practices and outcomes are, unfortunately, rare. Careful research of naturopathic medicine as actually practiced, not isolated interventions, is urgently needed. The survey research by Dr. Standish and her team, Complementary and Alternative Medical Treatment of Breast Cancer, a survey of licensed North American naturopathic physicians, cited pages 74 through 81, is important, but only as a stepping stone to the research really needed. The deeper questions are, does naturopathic philosophy improve healthcare? And do naturopathic intervention strategies affect the course of breast cancer and other diseases, as well as the patient's quality of life? The foundational naturopathic concepts of improving diet, maintaining physical fitness, avoiding toxicity, holding a positive mental attitude, and establishing a healthy lifestyle, once denigrated, are now widely recognized as critical to health. Will other naturopathic concepts prove equally useful, or do they need to be relegated to the scrap heap of failed ideas? A considerable amount of thoughtful research is needed. One of the results of the survey by Standish and colleagues is disappointing: the lack of collaboration and integration of care. A clear outcome of the past 2 years of work by the White House Commission on Complementary and Alternative Medicine Policy is the public's intense desire for collaboration and integration. During our 12 regular and 4 town hall meetings, we heard from more than 1,000 professionals and members of the public. Almost all encouraged us to find ways to improve integration and collaboration. For the vast majority of patients, healthcare is not an issue of either CAM or conventional treatment. They want both. They want healthcare that is individualized and improves their wellness, as well as healthcare that treats their disease. In the absence of practitioners working together, patients have to figure it out themselves, integrating as best they can. This study confirms the Commission's recommendations to educate CAM and conventional practitioners to better understand and work with each other, and to remove legal and financial barriers to collaboration. While the hot topic of the day is integrative medicine, aren't we really looking for co-management and collaboration? Integration happens within communities of practitioners. Expecting individual practitioners to truly integrate is unrealistic. The body of knowledge in CAM and conventional healthcare is simply too vast for single practitioners to master. We need collaborative care. We need practitioners to talk with each other. We need to share patient information easily and respectfully, as well as our informed insights, treatment objectives, and plans. This survey also has public health implications. 77% of naturopathic physicians report they treat patients with breast cancer. This is a remarkable percentage for primary care practitioners, and especially if it is indicative of other CAM professionals, it suggests that a substantial amount of cancer care is being provided outside the medical mainstream. This number also supports the White House Commission's recommendation to regulate CAM professionals in a manner consistent with their education and scope of practice. Public safety requires that CAM professionals who see cancer patients be appropriately licensed and carefully regulated. Limitations of the survey. While this survey provides useful information and guidance for future research, I'm surprised to see no differentiation between the diagnostic, practice patterns, and qualifications of those treating patients with and without conventional care. The survey could also have better differentiated the therapies used. Especially surprising is the lack of assessment of the therapeutic rationale used for the individualization of the therapeutic protocols. We need to understand why as well as what. Challenge to the naturopathic profession. Dr. Standish's study, as well as the White House Commission's experience, demonstrates a remarkable change in practice patterns and patient expectations compared to 25 years ago when I was seeing women with breast cancer. Those I saw then refused to see conventional practitioners despite my urging. This fear and rejection of the conventional now appears far less common. The desire for integration and collaboration is much better for all concerned. I'm also struck by how much the naturopathic approach to breast cancer care has changed. Unfortunately, without assessment of the intervention strategies being employed, evaluating the evolution of the sophistication of these interventions is impossible. The naturopathic profession is to be congratulated for using conventional diagnostic procedures to assess patient status and progress. This indicates the profession is maturing. However, naturopathic medicine, if it expects to retain a place in the healthcare system, must develop more consistent standards of care. I'm not suggesting all therapies for all patients need to be identical. This would fundamentally violate the profession's philosophical precepts to provide personalized care. What is needed is clearly articulated therapeutic strategies and well-researched rationales for how to individualize care, how to assess progress, and how to collaborate and integrate with conventional interventions. While we have started this work for many diseases with the textbook of natural medicine, there is no corresponding textbook of natural medicine for cancer. The time has come for naturopathic physicians treating cancer patients to articulate, debate, test, publish, and improve their protocols. Naturopathic doctors have for a century considered themselves physicians of natural medicine. With such unique positioning comes public expectations of practice sophistication, evidence of efficacy, and accountability. Are we living up to these expectations?